Hello, everyone, and welcome to this encore episode of the Psychology Talk podcast. Welcome to the Psychology Talk podcast. I'm your host, Dr. Scott Hoye. The Psychology Talk podcast is a unique conversation about psychology from around the globe. We bring you ideas from mental health practitioners and experts to keep you informed about the latest issues and trends. Topics include developments and research in psychotherapy and social sciences, hypnosis and mind-body treatments, meditation and spirituality, and new treatment modalities. And while you're listening, please take a moment to subscribe and give us a review at your favorite streaming site. It helps us to grow and further reach people with quality programming. And now, here's the episode.
So today we have Paul Fugelsang, the Executive Director of Open Path Psychotherapy Collective. Welcome, Paul.
Thank you. Nice to be here.
And Scott's on the line as well. Hey, Scott.
Hey there. How's it going today?
I think we're doing all right.
Okay, great.
Good. So we'd love to get an update. We know that Open Path has really grown since the last time we spoke. So can you give us a little bit of an update, Paul?
I'd like to also add that we spoke earlier to Lisa Eisenhart from Open Path, but she's on maternity leave right now, so Paul graciously agreed to appear with us today. Thank you so much, Paul.
Yeah, unfortunately for you all too, because Lisa is definitely much more conversational than I am. So I'm gonna wing it here.
Different style, but that's okay, man. That's just fine. You'll do a great job.
So, yes, Open Path has grown and is continuing to grow. We're talking at a milestone week for us because we just signed on our 10,000th therapist 2 days ago. So. Yes, that was exciting.
Congrats.
Thank you. It's been our goal for quite some time to make it so that every therapist in the country who's in private practice has at least heard of Open Path. And I have a feeling that we're pretty far away from that goal still, but every day, thanks to word of mouth and marketing and social media, more people are finding out about us. We've had steady growth since we launched back in 2014. But if we were to chart it, certainly around 2017, our numbers really started to climb. And I think it's just a question of momentum. And we're sort of riding a wave right now. And then when the pandemic started, we saw a very, very sharp increase back in mid-March. And my guess is that's for two reasons. One is because therapists started worrying about their practices because, we all started worrying about our pocketbooks during those weeks. And they wanted to fill their slots with Open Path clients. And then the second reason, which is one I'm more fond of, is that I think that people wanted to help out where they could, and therapists realized that Open Path was an avenue for them to chip in and help alleviate the burden from the pandemic. And then more recently now that it seems like a light bulb is going off for a lot of white folks about white supremacy and oppression, I think that people are also rising to a certain call. So our numbers since March have really, really grown.
Well, maybe what we could do is kind of go back and actually just state what the mission is for those of us in the audience who might not know exactly what Open Path Psychotherapy Collective is. If you can give the mission statement.
Yeah, sure. So we're essentially a 501c3 nonprofit organization made up of therapists around the country who are in private practice, who have committed to using one or two or maybe even more slots in their caseload to see a client at rates that range anywhere between $30 and $60 a session. On the client end of things, we ask for a one-time $59 membership fee. And then once a client is a member, they can see anyone in our collective as long as they need to. So what we do is we sort of act as a referral agency. Clients come through, they choose a therapist in our listing, we connect them, and then Open Path removes ourselves from the equation completely, and the client pays the therapist the agreed upon rate.
Right. So basically, it's a referral source, and it's free of charge for the therapists themselves, and there's a client fee for having access to those referrals.
That's right.
Yeah.
That's right. And we try to incentivize therapists to join. I think there's sort of the altruistic argument, which is that if you're offering sliding scale in your private practice already, which many of us did long before Open Path came around, that works. And the therapist is sort of acting as a lone altruistic agent. But if they're a member of this group, then because a therapist in Miami is offering affordable care, it means that a client in San Francisco can receive affordable care because we're all in this working together. So that's really sort of the main incentive that we push. But in addition to that, we offer free 24/7 advertising for therapists on our website, which gets a lot of traffic. And we also offer a bevy of incentives for therapists for managing their practice.
Mm-hmm. Okay. And you said, so do you have the numbers of, like, what's the average traffic that you're seeing on a regular basis?
I don't have that now. We get over 100,000 visitors a month easily.
Okay.
But it's actually been a little while since I checked in on those numbers.
That's quite impressive, though. And you said the numbers have been up as far as people actually joining since mid-March, correct?
Yeah, well, I think between mid-March to mid-April, our numbers really took a serious dip. I think,
okay.
Most people in the nation were stunned. And while people who had pre-existing relationships with their therapists probably kept seeing those therapists, I think it was a pretty tender time to initiate a new relationship with a therapist.
Mm-hmm.
But then right around mid-April, what we noticed was that the dust started to settle. People started to realize what was going on and what was up ahead of us as far as we could tell. And then clients really started signing up. So we had 1,700 clients sign up in the month of May, and then right now in June we're on track to connect 1,900 clients, so right around there.
And is that typical, or is that a higher number than normal?
Yeah, much higher. The most we'd ever connected was in January of this year, and that was around 1,400. So it's a pretty significant jump.
Yeah,
it is.
Yeah, we've had conversations about how the longer this pandemic goes on, the more people are going to want services or, be more willing to reach out. And so that's part of the reason that Scott and I wanted to have Open Path back on, was because we wanted to. This is a great resource, and it makes it more affordable for the client. So we really appreciate you coming on.
Yeah, well, thanks. I'm very grateful for the opportunity. Some of these larger companies that have millions of dollars in funding, private companies that offer what they call affordable care, a lot of the text-based companies and that sort of thing, they have millions that they can put towards advertising to get the word out about what they're doing. And we are, relatively speaking, a very small nonprofit. So anytime we can get the word out, we're always very grateful.
Yeah, absolutely.
Yeah. Well, it also seems to me that a lot of the bigger tech companies that are reaching out into the realm of therapy, I think that there is it just seems money driven, and it also seems like you're turning therapists potentially into indentured servants for those companies in a lot of ways, and offering something that ethically, the therapists aren't doing the marketing. The company can sell it because they're not providing the services. But it's kind of a mechanistic approach to therapy that seems that they're selling, and it will probably give people some relief on some level. But it kind of destroys the relationship, the kind of healing relationship. To me, on some level, I don't think it cultivates it in the same way that, say, for instance, the Open Path gambit does. It's basically, it's leaving it in that relationship you establish with your therapist is kind of sacrosanct, and it leaves it into the realm puts it into the realm of something that's confidential and safe.
Yep, I completely agree. I think that was all very well said. When I started Open Path, my primary motivation was to create something that would more or less mirror the experience that someone goes through when they have money in their pocket or they have really good mental health coverage in their insurance.
Yeah.
As opposed to the way so many people are delivered affordable services back then when I started, and now the way they're doing it through these tech companies, which I do think is at best a watering down of a very, very well considered, well tried process.
Okay. Mm-hmm. Yeah.
Yeah. So what are the goals for Open Path? I know you said earlier that you wanted to reach all therapists. You wanted everyone to at least know about Open Path. What are some of your goals for the upcoming months?
Yeah. Well, it's interesting because I reached out to this old board member earlier this week when we hit 10,000 therapists, because back in 2014, during a board meeting, I was bragging that we had about 400 therapists, and which seemed like a very large number to me at the time. And she said, "Oh, that's great. When are you going to get to 10,000?" And at the time, I thought, "Yeah, we're going nice and easy here." And that's actually sort of the way we've always approached it. We are growing right now more quickly than we have ever before. And at the same time, we're trying to be very, very conscious and to move very, very carefully with what we do as an organization, with the staff that we have, and then also with our relationship with therapists and clients. So I often liken, and I think maybe this might also be a philosophy I carry with how to live life. I feel like I'm on my hands and knees and I'm reaching forward and looking for the next stone, and then I find it and I put it down and then I move forward. And and I think that's kind of what we're doing with Open Path. So to answer your question, I think our goals are, to keep moving ahead and to keep having our eyes open and keep putting the needs of both the clients and the therapists first.
Well, how might you be shifting? How might Open Path be kind of shifting in light of the COVID-19 pandemic? We did mention some of the issues with race that have come up culturally and politically right now, but maybe you can address both of those and see how Open Path is kind of addressing those.
Yeah, so it was pretty interesting to watch this entire profession. Those of us who were not seeing people online to shift pretty quickly and suddenly equip ourselves with that capacity. So right now, I think it's safe to say 100% of our therapists are seeing people online, which, my original intent with Open Path was to have online be an option, but I really wanted people to be able to do in-person therapy, which I'm sure we'll get back to eventually at some point. In terms of how we're addressing the needs right now, because our numbers are climbing so quickly, we are doing everything we can to recruit more therapists. We're in the process of hiring a marketing person. I've sort of been winging this the whole time, not really knowing what I'm doing at all. And then Lisa came on and sort of cracked the whip a little bit and got me into shape. But Lisa's also not a marketing person. So we've kind of been picking it up as we go along. And right now we're in the process of hiring someone to help us recruit more therapists, because it is really a more and more pressing concern as word gets out and as more people need affordable therapy. And then we're also working with a few organizations, the Loveland Foundation being one of them, that works to help people of color access either free or low-cost psychotherapy. And we're in talks with some other organizations. A lot of people reached out to Open Path over the last 2 weeks and trying to figure out how they could partner with us. And I'm completely open to partnering with organizations to help people get low-cost therapy, but it's also my my preference that they do a pretty wide search, because I'd rather people, an organization came to us the other day and said that they had $120,000 that they wanted to dedicate towards helping people get low fee or free therapy. And, to a nonprofit like us, $120,000 is a ton of money. We talked about it, and I gave them some other resources to check out first, because I want to make sure that if someone's going to spend that kind of money, this is a corporation, they're going to spend that kind of money, that they're going to get the most mileage for their money that they can.
Okay. And so that particular organization, you're trying to make sure that the fit is right. Is that what you're saying for both sides? Yeah.
I'm trying to make sure that if there's a better option out there somewhere, or a better way to do it, so that more people can get served, that they'll go with that option.
Okay.
And Path is the best direction, and we'll work with corporations like that.
Okay. Well, and so you're the founder of Open Path. I'm curious about the history of that and how it all came about. Could you tell us? People didn't listen to the episode with Lisa. I think it would be really interesting for people to hear from you.
Yeah, sure. So I had started a private practice, and like most therapists, I felt like it was my ethical responsibility to offer at least 1 or 2 slots at a lower fee. And when my practice filled up, and people would call looking for something lower than my hourly rate, and I had to turn them away, I had nowhere to refer them to. So what I would do is maybe give them a few names and say, maybe these therapists will see you for a lower fee. I don't know. You have to call them and find out. And it sort of seemed like that there had to be a better way than that. And when I was doing my clinical internship in Boulder, Colorado, I worked at a nonprofit that was, this place where they bought an old Victorian house and converted all the rooms into treatment rooms, and then would see clients for a very, very affordable rate. And what I realized when I was doing that was that it was staffed primarily by student interns. So we were all making all our mistakes, our first go round on these clients. And also that the administration of this place was spending the majority of their money and time and resources fixing leaky pipes and repairing carpets and trying to buy new couches and trying to afford the mortgage. So when I put those two experiences together, I realized that, we're still in the very early days of the internet, I think it's safe to say. And it suddenly occurred to me that the internet could be used as sort of a waiting room where we would receive people looking for low-fee therapy and then direct them to the private practices of therapists who are willing to give it. And I wasn't sure if the idea would take. I spun it around for a long time, and I talked to a lot of therapists I knew about it. And then I managed, through the overwhelming generosity of my friends, to raise about $17,000 doing a GoFundMe, and that paid for the website and some of the initial startup costs, and we were off to the races. And luckily, therapists did take to the idea, and again, I'm very grateful for that.
Yeah.
Excellent. Okay.
Yeah, I like the metaphor that you used of like a virtual waiting room.
Mm-hmm.
Yeah.
And it feels good the way you described it earlier, where you said, you kind of create that initial contact between the therapist or the client and the therapist, and then you remove yourself. That feels, if I'm looking at it from a client's perspective, that feels very safe. It's like an intermediary, right? Like here's your therapist, and if that works for you, great. If not, come back to us and you can find another one. But there's not much effort on their part to do that.
Yeah, I would say from the client perspective and the therapist perspective that they don't really need somebody in the middle, and the therapists actually, they don't need a company like ours paying them the fee and taking the bulk of the fee for our coffers either.
Yeah,
the way these other companies do.
Yeah. So what's it been like for you as someone who had your own private practice or has your own private practice, and to have this grow as a second thing that you're doing? What's that process been like for you?
Well, there was sort of a gradual shift where my private practice started to wind down, and as this was building up. I do long-term work with people, so I have a pretty small caseload right now. I probably see 5 to 7 people a week, and most of them I've been seeing for years and years. So I don't think I could do this work and not be a therapist. I really appreciate the fact that I can still be active in the field and do work with my clients.
Yeah, they probably, I would assume they inform each other. Like being a therapist informs your approach to directing Open Path.
Absolutely. And continuing to learn about the field of therapy has been really crucial. Yeah, I couldn't imagine being an executive who came in without any experience in this field, and then I would feel like I was pretending to know what I was doing.
Yeah. So I'm wondering if there's, I guess, if we have people who are both a therapist or a potential client, what would you like them to know about Open Path?
Yeah. Well, for therapists, we've been really, really careful not to nag anyone or try to convince them that they should be doing this or offering sliding scale. I'm really happy for people to make up their own minds around that. And if a therapist is interested, I feel like our website is pretty clear, and I feel like we create a fairly supportive community for therapists, and I think most of the therapists in Open Path would say that they enjoy being members of Open Path and being part of the community. So I would really invite them to check us out. And then for people looking for affordable care, unfortunately, I never could figure out how to make the model work for people who fall well below the poverty line. I really tried it, and I could not figure out how to make the model work. So most of the clients that we see are people who are sort of lower middle income, and which increasingly makes up the bulk of the American population. So I would hope that they would come and see our site as well. We try to make the process both for therapists and clients as simple and non-invasive as possible.
And I can say that Scott and I can both speak to how simple it is to sign up as a therapist. And
absolutely, yeah.
Yeah. And it's been a good experience for us. I was wondering if this just came off the top of my head. But I was wondering if there is there potential maybe to create the ability to offer pro bono sessions. Like, is there a way to build that into Open Path as an option?
Yeah, it's actually been a hotly debated topic amongst our staff since the pandemic began, but especially in the last few weeks. And I think that what we're looking to do right now is to figure out how to create some sort of fund for people where, through donations, where we could receive this money, put it in a fund, and then reimburse therapists from that pot. It's a bit of a logistical conundrum, the way all things are. We sort of have our thing working right now. We have the machine oiled, but I don't think that's an excuse not to find the way. So I think right now we're working with our tech developer, and we're trying to figure out how we can make it so it would work on our website and then get that pot going.
Okay, Sounds good. Always looking for different ways to support. Yeah. So I'm wondering, is there anything anything that we haven't really covered today? Anything that you'd like our audience to know? Also, are there anything coming up for Open Path that we need to know about, and ways that we can contact you?
Yeah, sure. So contacting is really easy. You can go to our website and go to the contact page, and my email address is on there too. If someone wants to contact me directly, that's more than welcome. I think that everyone is sort of figuring out what's going on and trying to guess what the days up ahead are going to look like. And of course, it's a really huge, very consequential question mark. So we're doing our best to sort of navigate the road ahead. And like I said earlier, we're trying to do it with our eyes wide open. In terms of what people should know or could know is, I imagine that the bulk of your listeners may be therapists or people in the mental health field. And I would just ask that if people are in the mental health field and this is not for them, or they're not in private practice, but they do know people who are in private practice, if they do want to lend a hand to what we're doing, to ask them to please share our information and our URL with people they know who might be interested in helping us out.
Mm-hmm. Yeah. And I think that you mentioned people who might not be in private practice. I think hospitals, outpatient or intensive outpatient settings, even community mental health settings could greatly benefit from their patrons, their consumers could greatly benefit from having Open Path as a referral source, I think.
Yeah, I think so too.
Yeah. Okay. All right. Well, it was great talking to you. Thanks for coming on.
Thank you so much for having me. It was really nice speaking with you all as well.
We appreciate your time so much.
Sure. Maybe next time Lisa will be back and the two of us can chat.
Thank you for listening to the Psychology Talk podcast. Did you know you can find us on the web all over the place? Well, maybe not all over the place, but you can find us on Instagram, you can find us on Facebook, you can find us at Spreaker, Stitcher, Apple Podcasts, loads of places. Please look for us, and if you can, subscribe, like us, leave us a review, send us a comment, a criticism. Hey, we like to hear a lot from people. Go ahead, talk to us. That's why we're here. By the way, this is just a reminder to let you know that all of the material here is for entertainment and informative purposes only. If you do need a therapist or a mental health professional, please seek one out. Music is provided by the band Serenati.